Well, welcome everyone to yet another edition of Three Plastic Surgeons and a Microphone. It has been a while since we've been recorded, and we're so glad to be back after a little summer break. As always, I am joined by Dr. Salvatore Pacella from La Jolla, California, and Dr. Sam Rhee from Bergen County, New Jersey, or Paramus, New Jersey. I'm still getting that down. Today we're talking about
it's only been a few years.
I know. I don't know why I stumble with that, but we all have our things that we struggle with. That's apparently one of mine. Today we're talking about a really exciting topic that Dr. Pacella is going to lead the conversation. We're going to talk about what are called mini lifts or sort of lesser invasive facelifts and what's entailed with that. So before we get going with that, Dr. Rhee is just going to read the normal disclaimer of our usual business.
This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or any qualified or other qualified health provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking advice because of something in this show.
Wonderful. So, Dr. Pacella, I'm excited to pick your brain on this because, we'll get calls in the office and you have some patients that are trying to avoid surgery to look rejuvenated, other patients that are ready for a full-fledged, facelift, neck lift, brow lift, all that sort of thing. But you're talking about someone that kind of falls, I imagine, between those two categories. Or tell me, what is a mini lift?
Well, so a mini lift is a procedure that is designed to minimize the total amount of scarring and minimize the impact on the patient. But before we get into that, I just want to maybe chat a little bit about the philosophy of facelifting, and sort of what that means to a plastic surgeon. And I could tell you that throughout my career, I've trained with some incredible surgeons. And each time I've scrubbed with some of these giants like Dr. Hester, Dr. Nahai, Dr. Codder, they had been in practice for many, many years. And I asked them, when did you feel completely 100% comfortable with facelifts? And you know what their answer was?
What?
I still don't.
Oh,
Okay. No. And I took that I took that to believe not necessarily that the operation is technically challenging. It does take a tremendous amount of knowledge to understand where these nerves and blood vessels are going and what plane you're supposed to be in. But the finesse associated with creating an appearance that looks like it hasn't been lifted or it hasn't had surgery. Okay. And to me, that is the holy grail of plastic surgery, to look like you haven't had surgery. Right. I'm from New York State, originally upstate. I trained in the Midwest like you guys. I trained in the South. Not to rag on our guys in Beverly Hills, but there's a certain look of facelifting out on the West Coast that's a little odd, right? I mean, patients look like they've been overpulled, overdone, windblown, etc. And the tailoring or the bespoke nature of facelifting that I feel like I've picked up over the years, I think really gels to this. It's not a procedure where you're going to come out looking like, man, you had just this complete wind tunnel look. I approach this in a way that makes it look natural, makes it look feminine for the most part, and less traumatic on the patient's skin.
Yeah, and I love the term bespoke. I mean, I think that really illustrates that in this era right now, where it seems as though people are calling and everybody wants to get a deep plane facelift, which means they get the deep soft tissue repositioned somehow. Not all facelifts fit all people. So tell us a little bit about how mini lifts sort of fall into that bespoke approach that you take.
Right. So to me, a mini lift, or what we call a short scar facelift, is a procedure that really is designed for the central area of the face. This area, the central triangle of the face. And it's really ideal for middle-aged women or middle-aged men that really see this folding near what we call the marionette lines or the nasolabial folds. Unfortunately, it is not a procedure necessarily that is designed to really get the central neck here. So if you have a patient coming in, I'm sure you all agree that when patients come in and they have these thick, long platysma bands underneath their chin and a massive amount of excess skin, A mini lift or short scar lift is really not going to do that. To some extent, it will do it a little bit because the vertical component of the pulling will get a little bit of this. But somebody who's got a tremendous amount of sun damage, it's just not going to do much for that. And I think patients understand that once you sit down and you explain it to them. The other difference I would say in a mini lift compared to a full deep plane facelift that I may perform is the angle of pull. So for example, when you have a pull on the neck, you're pulling a little bit more posteriorly and you're pulling a little bit more obliquely. With a short scar lift, the key is pulling this in a vertical way without creating bunching in and around the temple. And so to me, that's the key. I try to use this analogy for patients, and getting back to the whole bespoke thing, right? Many times patients come in, they don't know a ton about facelifts and they say, well, I just want my neck done. I just want this. I just want to pull this, right? I don't want to go into the face, or I want to just concentrate on here. I don't want to go into the neck. And I use this analogy. I say, well, let's imagine you're shopping for a dress for an event. Okay. And you don't want to spend $2,000 on a designer dress. So you go to Nordstrom Rack and you see this beautiful dress and it's discounted 90%. You pay a couple $100s for it. You try it on. It's a little bit too loose, right? So you take it to this tailor next door to Nordstrom Rack and you say, I just want the waist taken in a little bit. And they say, no problem. So then you try the dress on and the waist is tight, but everything else looks odd. The bust is bunched up. The A-line is all sort of mangled, right? And that's a lesson for patients, right? Because in order to make these things look natural, you can't just address one area. This is a continuum of skin throughout the middle face and the neck. You have to sort of taper this into these anatomic planes. And I think patients get that sometimes, or many times when we explain it.
Yeah, I think that's awesome. I think, one of the things that I know you talk to your patients about too is we sometimes patients will get the skin component of their facial aging and the deeper soft tissue component a little bit confused. And where I think the mini lift that you're going to tell us about comes into play is when people, particularly where their neck is concerned, don't have a lot of skin excess for their neck.
Right.
You can do a wonderful job sometimes actually taking care of those, there's issues with their neck and still keeping a relatively short scar. I think a mini lift is a really, really nice option too in women that have short hair, men in particular, like when you want to hide that scar. So I know you have some cases that I think you're going to show us that'll
Sure.
help illustrate that. That would be awesome if we could see those.
Yeah.
Absolutely.
As you bring those up, I do want to just concur that when you say bespoke, I think what some patients do, and we just talked about this a second ago before we got on, is people get caught up on terminology. Like, is this full? Is this mini? Is this? And a lot of, is this deep plane? And a lot of it is really trusting the surgeon that you go with to know and recommend and talk about these different things. Because honestly, we've all seen people who've gotten certain procedures that by definition are one procedure, but it's something else. And I think that really what you need to do is say, okay, forget about all these terms because, they can be misleading. What is it that you want to do for me? What do you think is going to make me do the best, i.e. a bespoke procedure, something that you said in your words, like let the dress fit me. Let me figure out, tell me what that is and forget about like all these terms. That being said, I think the great thing about mini lifts or the term mini lift is that you're trying to emphasize the least invasive type of procedure that will achieve the result that you want to get. And I think that that's really what patients want. What is the least invasive procedure that will still help me achieve the results that we're looking for here? And if you're going to use that term mini lift to embody that, then you and your surgeon are on the right track with it.
And, I would say the beauty of the mini facelift too, is that I try to combine a little bit of fat transfer, not a ton, as well as the skin and deep plane lifting. And this could be done in the office in a short period of time, 2 to 3 hours, not so much the lifetime or the lifestyle or lunchtime lift that were very popular years ago. But this could be done under just oral sedation with injection and local anesthesia. So that's the real beauty of the procedure.
As you're talking, a question for you. When you're describing a mini lift, is there ever a submental incision as part of it? Or is it all?
Usually not, just a
Okay.
lateral facelift. I think, in my practice, when I make a submental incision, I'm going pretty deep into the neck. And to me, operating on the deeper plane of the neck through the center portion in an office setting that's asking for trouble,
Yeah,
little bit of
no. Well,
bleeding.
no, I totally get that. I just didn't know if you were defining that
No,
as
yeah.
a mini lift as well. So is a mini lift in your practice then just done under local in the office? Are
Yes,
these
yes.
okay? Okay.
But to be honest with you, sometimes patients just, they want to be put to sleep quiet. They want to be comfortable. And I'll do a mini lift under general anesthesia too, particularly if we're doing it in the setting up. Look at this guy right here. This guy right there. Particularly if we're doing it in the setting of a brow lift or blepharoplasty or something like that. So it's really related to the technique, not necessarily the anesthetic component.
Got it.
So that being said, let's kind of dive into a few cases here. So, okay, so here's a older lady. She's in her late 70s and really concerned about the marionette lines of her face. And what I refer to that as this area right here. This is where, if you see this sort of rectangular appearance that she has to her face, this is what drives people nuts when they want facelifts, both young and older women. And so with her, this was done in the office setting under local anesthesia, with really the intent of concentrating on just this area here, this central triangle to the face. So the incision was made just in front of the ear, and we added a little bit of fat to the cheek line. So if you see the difference here, I think this says a lot between taking a rectangular face and making it look more oval or triangular.
So you just did a short scar facelift on her without any, because
Yes.
her platysmal bands are gone. Well, how did you do that?
So
how did you do that?
We did a little bit of Botox underneath
Okay.
there and pulled a little bit laterally. So with this particular patient, I pulled a little bit behind the ear, not all the way extended to where I'm going to go behind the ear along the hairline, but a little bit more towards the posterior aspect of the ear. So again, this is exactly what I was talking about, bespoke. You've got to tailor your technique to every single patient. Not every single patient looks exactly the same or has the exact same anatomy.
And how far post-op is she in this? Like, how long did it take?
These are
for her?
a year. My policy is to never show pictures that are beyond or that are earlier than a year.
Well, let me ask you a different question, because patients obviously
Mhm.
are concerned about their amount of downtime. Do you tell them when they're getting, because a traditional facelift where you're doing a lot of deep soft tissue manipulation, their swelling is substantial for 6 weeks, and they may look like they're a little strange for 3 or 4 months. What do you tell these patients how long they're going to look socially unacceptable?
Well, I it's funny you use that word socially unacceptable, because
Hack
that's
Newman.
exactly the word I use. Hack Newman, right?
I came from Hack Newman, exactly.
And so, I tell patients not to discount how much recovery is involved with this. I mean, a facelift or mini lift is not a skin procedure. It's not just on the out surface of the skin. We are deep down inside there. We're just doing it in such a way that it's going to minimize the scar. So there is a lot of swelling. I try to cut that time in half, but sometimes it's longer, sometimes it's less. It depends on the patient, but I do try to tell them you have to be prepared for a bit of swelling.
Now,
And I think that's, oh, sorry, Sam, go ahead.
I was just going to say, so that jowling correction is strictly with a SMAS plication?
No, this is a SMAS elevation. So what I did in this particular case was I did a high SMAS technique, so not application. So going underneath the SMAS down to release the deeper facial ligaments, and then resuspending this above the zygomatic arch at the temporal fascia. And that's what gets the neck, right? When you're pulling in a vertical component, even though you may not be going into the neck and tightening up the platysma bands, you are suspending them just by continuity.
How much of a smash dissection? How much of a
You're
smash?
doing this in the office?
Yeah.
Did this in the office.
I was about to say, because how far down the SMAS are you dissecting? Because you can get into tiger country there with the nerve branches, right?
As far as I could see, as far as I could go. And I'll usually use a blunt dissection, spreading scissors to avoid any major cutting. I mean, I have essentially the same setup in the office as I do in the operating room, right? So I have loop dissection. I wear loops. I wear a headlight. I have the same types of retractors, and you'd be surprised at how well you can go. The other key component to this, which is discounted, I think, is the anesthesia component. Okay. So several years ago, I switched my practice for anesthesia from simply just using off the shelf lidocaine with epinephrine to fresh mixture of lidocaine, marcaine, epinephrine, fresh epinephrine, and tranexamic acid. We had a discussion quite a while back about TXA as an adjunct to local anesthesia. And I think that's a total game changer. That really minimizes the blood loss, particularly when you're injecting it deep into the face, which makes the operation so much more smooth.
TX and day.
TX and day.
A couple things I want to point out to the listeners of this. One, because Dr. Pacella had mentioned the lifestyle lift. Lifestyle lift, for listeners who haven't heard of it, was a company that went bankrupt after multiple lawsuits, where they would basically do a very small skin elevation in the office. If they had there was a national company, so they had, tons of ENT and plastic surgeons working with them. If there was any work done on the deeper soft tissue, it was minimal at best, and the results didn't last very long. Dr. Pacella is doing an in-office facelift with relatively small scars, but he is doing a very real facelift on these patients. This is a substantial manipulation of the deep soft tissue through minimal scars. And so it's important that listeners sort of understand that even though we're describing a mini incision, this is not mini results. This is not mini recovery. This is a real substantial facelift. And honestly, I think I would not feel comfortable doing this in the office. I don't have the same setup that you have in the office, and my OR lighting is just substantially better. I'm blown away by how good of an in-office facelift this is. But again, I don't know anybody else that does this good of an in-office facelift. Like most people in-office facelifts are a little bit of skin dissection and a few stitches in the SMAS or the deeper soft tissue, and they call it a day. So this is awesome.
Well, I agree. I think you did some real foundational work here, which is why I was asking about the extent of your SMAS dissection, because you can only get this if you're really moving that SMAS in a significant manner, which, as Sam says, most of the time, a lot of these in-office procedures are sort of faux SMAS,
Yeah, because you have to do considerable dissection. I mean, in order to get that degree of elevation.
Well, so I think, to me, that the key is really where you enter into the SMAS. So for example, you guys may feel the same way when we did facelifts at Michigan, but we would always start the facelift, the sub-SMAS component of the facelift or the deep plane component of the facelift, kind of right around here at the zygomatic arch. And I got to tell you, years of frustration of doing that. It's like, you start pulling the SMAS, you don't know how thick it is, you don't know how thin it is in certain patients. You start pulling through, you get into the parotid fascia, you get holes in it. It's just it's a real pain. So years ago, I started entering down here below the ear. Okay. So right as the platysma starts, the muscle is thicker, and you can use that to sort of create the plane that you go superiorly. So, and that means, and you could still view this by just going a little bit behind the ear. You don't have to make this big sort of extended neckline lift. But just right here, you can really get into this platysma very nicely, and that just creates the plane for you going immediately.
What do you use to suture your SMAS plication up to the zygomatic?
I usually use 2 OPDS. So I think, I'm a firm believer in using absorbable sutures, but sort of semi-permanent absorbable sutures. I don't see a real need to have Ethibond or thicker sutures in the middle of the face. Those oftentimes not, and they don't go away. For all practical purposes, PDS is a permanent suture. By the time tissue planes are attached, you don't need the PDS anymore, in my opinion.
And where do you get the fat to graft to the?
Just from the abdomen. Oh, just from the abdomen. Okay. Yeah.
So I would say, so that's again a substantial. How much fat did you put in her?
About 10 cc's on either side, so not a ton.
So how much local are these patients getting with this degree of fat grafting? And this degree of dissection in the face? Do you worry that sometimes that you're sort of exceeding the concentration that we would want to give a patient?
So great question. I went over this with my pharmacy, the pharmacy manager at my hospital, at Scripps Green Hospital. And the way the aliquot is performed or mixed in by pharmacy. So let me back up a bit. So when I do these kind of cases at the hospital and I desire this local anesthesia that is pre-mixed, they do it in such a way in the pharmacy to make it sterile in the operating room, et cetera. And so there is a 50 cc bag of saline that all of this goes into. And so by the end of it, it turns out to be about 70 cc's. You can use up to 2 bags of that safely because the concentration of marcaine and lidocaine, which are the rate limiting steps, is so diluted, okay, that it's safe. So routinely, if I do a full facelift in the operating room, I may use 70 to 80 cc's of this mixture. And these patients are being watched under general anesthesia. They're getting an EKG constantly. They're getting their O2 sat monitored, et cetera. So I need dramatically less for an in-office mini lift. Okay, maybe half. So I usually do about 20 cc's on either side in the middle of the face here. So that's about 40 total. And then I'll inject tumescent into the abdomen in a small area, maybe 20, 30 cc's at most to get the amount of fat I need. So it's not dramatic, the amount of local anesthesia they need. I think it just potentiates so much better with the epinephrine. Fresh.
Yeah.
So,
well, yeah. I think, so do you have like an outpatient surgery center option for you to do your facelifts in? Because it's interesting where you're talking about the hospital versus doing it in your office. I guess.
Yeah. So I operate in 3 places. Okay. So I operate in the hospital ASC. Okay. I operate at a dedicated outpatient ASC.
Okay.
And then I have a office procedure room that I do most of my skin cancer repairs on. Okay. So that office procedure room has surgical lighting. It has a Bovie. It has everything you need except for an anesthesiologist. Okay.
Got it.
So I have the benefit of doing that. Now, interesting you say that because now my philosophy is as a surgeon, when I do a neck procedure, so a full deal deep plane facelift, I'm never doing that in the office operating room. And I actually am never doing it in the outpatient ASC. I'm always doing it at the hospital ASC because, deep inside the neck, I don't care how good of a surgeon you are, there can potentially be problems. There can be problems with airway. There could be problems with swelling. There can be problems with hematoma. Okay. A lot of these patients are older, 70, 80. They all have a lot of them have medical problems, diabetes, high blood pressure, et cetera. I am doing that case in the hospital with the intention of sending them home. If there's any blinking, anything that goes afoul, they can be admitted immediately. And to me, that is a tremendous amount of comfort when I'm doing this. And I think it's a comfort to patients too,
that makes a ton of sense. I've got a slightly different setup just because we've got an overnight facility as part of our ambulatory surgery center. And I feel like our surgery center, which is a dedicated plastic surgery ambulatory surgery center, just runs more efficiently than the hospital. So it's just personal preference. But I get it. That makes a ton of sense. Well, show us the next case. I know you've got more than one.
Okay. So here's a lady, in her mid 50s. Okay. And if you can see here, she's got, deep jowling in and around the face. Okay. Right here. And so I did a combination of fat transfer. Okay. And this was a mini lift also done, under sedation, but in the operating room. Okay. Now the difference is with her, this was done in the hospital in the operating room, meaning we can have comfort. We can put her to sleep if needed. This is done under deep sedation, but even with just a little vertical pull here, you see this connection to the neck here, the skin underneath the neck, we got a little bit of pull here. We didn't get really the bottom portion of things, and that's okay. That's exactly what we're talking about. So the mini lift can get a bit of the neckline as well.
Great. Yeah. I mean, she looks 15 years younger. What a great result.
Yeah,
and the shape of her face has changed so much. How much fat did you put in her mid face?
About 12 cc's on either side.
You know what's
Yeah,
great
that looks
about this
awesome.
is that the mini lift adds a lot to it, but then the fat grafting adds a lot to it. And either alone would not help you achieve such a great result, but they're almost synergistic in the way they sort of reshape the face and the facial dimensions, which is awesome.
Another one here too. Lady's a little bit older. She had multiple facelifts in the past. I think mine would have been her third facelift. And you can see she's got this marbling of her skin in and around the perioral area, some deep pitting acne scars. This was her after a simple in-office procedure. In her, I believe I did a SMAS plication, not necessarily a deep plane all the way in. And, with this kind of marbling you see in and around the perioral area and around the nasolabial fold, depending on how deep you go and how medial you go with the facelift, you can really get at that very nicely. Unfortunately, she has a turtleneck on here. You can't really see her neck. So
That's the way to make your neck look awesome in your post-op pictures. Long hair and a turtleneck. I love it.
Another one here. So you can see here, she's, very, very attractive lady here, but really unhappy with this central jowling she has around the marionette line. Simple office procedure, mini lift, and, we've gotten a really good line. You can see this kind of central wrinkle right here at the jowl. That's pretty much ablated afterwards. If you look at this corner of the mouth right here, much tighter and quite a bit more snug.
I'm just impressed how much improvement you can get so far medial periorally. Like that's impressive.
Thank you.
Yeah, nice results. Well, good. I think that's been an awesome conversation on, I still think I love that Dr. Pacella is calling these mini lifts because these are full-fledged mid-face lifts through a short scar. Not a lot of people can do these operations, Dr. Pacella.
Who might?
I'm trying to think.
I can tell. There's a few.
Yeah.
Maybe you guys.
Maybe Steve.
Maybe Henry.
Maybe Henry.
Yeah,
Yeah,
maybe Henry.
but-
Maybe Steve.
Yeah, but great results.
Thank you.
Really elegant operation that you're doing for patients. And again, it just shows how you can offer the full armamentarium of facelift procedures in a variety of clinical settings to tailor to the specific needs of the patient. So,
And I think
very nice.
Again, the term is misleading because, as Sam said, if someone else says mini lift, we're talking about a completely different animal than what this mini lift is. And so it really behooves someone when they talk about these terms, asking the surgeon, what exactly are we doing here and what is going to be achieved? Because like Sam said, what you're achieving with a mini facelift is 9 million times more structurally intensive and better than what most people out there would think or would do in terms of what a quote mini lift in office would be. So,
This is
and
almost
then
this is almost like a CrossFit mini lift, right? It's like on steroids.
well, it's interesting to come back to
Don't
the whole
talk
deep,
about crunch.
exactly. To come back to the whole deep plane conversation, right? There are so many patients that were calling and wanting a deep plane lift, which this is not technically a deep plane lift because you are creating a different elevation of the skin from the deeper soft tissue, but there's extensive repositioning and manipulation and augmentation of the deep plane. And so this is a mini lift, but it is a very extensive deep plane lift all at the same time. So it's a great operation. Beautiful results.
Thank you.
Well, anything else to add, gentlemen? I feel like we've done a really nice kind of summary of a short scar facelift and the potential that it can have. Any last thoughts?
no, very impressive.
Thank you. I would say the first rule about mini lifts, always talk about mini lifts.
Your dog is so cute. Do you see your dog in your background, Sal? Like she's right by the window.
Oh, hey, come here, buddy. Come here, Hockey. Yeah, he's a Velcro dog. He just doesn't leave your side. He's great.
Love that.
That's awesome.
Love it.
Nice. All right, y'all. Well, let's call it a day. Good catching up.
All right. Thank you.
Signing off.